Do you want to be well? You may be sitting here thinking, I am well, it's the rest of the world who's gone mad. Or you may be nodding silently, thinking about whatever health condition you're facing. Or perhaps what you really want at this point of the day is some caffeine. But this was the question that I was being asked when I made the life-changing decision to leave my professional, comfortable career 7 years in. And it's the question that many whom I care for are hoping will be answered by their doctor. It's the question the paralytic man had at the pools and had to ponder when Jesus approached him. And part of truly becoming well is recognizing that we are sick and that something needs to change. What do I want to change? I want a revolution in women's healthcare. I want to change the staggering statistic that 99% of all women have used contraception at some point in their life. I want to change the fact that there are millions of embryos who are frozen and may never meet their families. I want to change the approach that doctors take towards women's fertility and their natural cycles. And I want to throw out the homogenized recipe, one-size-fits-all approach that's incomplete in its counsel and mute in its alternative approaches. Medicine is a noble profession, but I think we've lost our lodestar, which is protecting the unalienable dignity and rights of each human being whom we serve. And so today we're going to learn about 3 particular parts of my field. First, why it's a myth that current conventional treatments being offered in women's healthcare are always safe and always effective. Second, why this is true for contraception and why it's true for IVF. Third, what are the less used options that can address the root cause of these GYN issues that are safe, effective, well-tolerated, cost-effective, and respect life? So what gives me the authority to speak with you today about this? I was one of those doctors who I'm railing against once. I prescribed contraception for everything. I had no clue about harnessing women's own cycles to understand their fertility or as a sign of health. And I didn't question when I was told that life begins at implantation. So I'm very sympathetic to those who can live with this cognitive dissonance because I was blind for a long while. So what happened? How did I get from that place to this stage? I kind of liken it to a tsunami. You know, when in tsunamis, the wave is really strong, but when you're in deep water, it barely produces a ripple at the surface. I had the strong foundation of my faith from my childhood, but in the deep waters that I'd gotten into, it was barely discernible. And so this was the case despite starting my OBGYN residency, where I had to confront the moral and ethical dilemmas related to women's health head on. It was an insane time. I was working over 80 hours a week. Lives depended on the decisions that I made. I used my hands to operate and to deliver babies. And so it was exhilarating and exhausting. And then I was accepted into a reproductive endocrinology and infertility fellowship, which started with the good intentions of wanting to help couples who were dealing with the common and life-changing issues and impacts of fertility and pregnancy losses. But as I practiced the daily tasks of my profession, I realized we were playing God. But at that time, I was just focused on the terrible suffering that many couples with infertility endure. The end game is what mattered to me, the child's at the end of that treatment. And so I wanted to help the suffering of girls and women who couldn't even leave their homes because of terrible period pains or because they were ashamed because they had acne and hair growth from their polycystic ovary syndrome. Still, I did notice that I was giving the exact same treatment, hormonal birth control, for lack of periods, painful periods, too frequent periods, too heavy periods, for acne and hirsutism. These challenges need a variety of tools to address, as I later understood, but I just had the hammer of conventional medicine. It was impossible to ignore the moral questions raised by some of the situations I faced, like family completion through sex selection. This is when a woman, who many times doesn't have any problem conceiving, takes injectable fertility medications in order to mature multiple eggs. These are then removed by a needle going into each follicle and sectioning out those eggs. It's done in every follicle in both ovaries. The eggs are then combined with sperm, many times in a procedure called ICSI, where an embryologist places and injects that sperm into the egg, and there's an 80% chance that egg will get fertilized. The embryos that are created then undergo a biopsy a few days later, and the chromosomes are screened. And then the parents get the results, XY, XX, and then they literally discard all the boys or all the girls based on their desires. This was just one part of my typical day. And so the wave, which was God's love and will and call for me, built, and it was impossible to ignore. And so my work started to really cause me pain, which was a heartache at how medicine and bodies were being manipulated at astronomical costs to get the desired outcome. And so questions were bouncing around my head and my heart. Why are we treating women's natural cycles as defective? Why are we trying to completely suppress their normal function? Why we're so motivated to give them synthetic pills that essentially function as Band-Aids? And why are we learning such a one-sided and rote approach to managing diverse conditions? You know, the questions and the answers troubled me. I knew that much of what I was taught was wrong and contradicted the reality of the architecture that God designed. And so I felt God stirring in my aching heart, and I knew what I had to do. And so I quit. I quit my well-paying, secure job. I opened up my own practice, and it's based on two principles. Women's natural cycles and fertility are a blessing, and we need to treat root causes, not just symptoms. And as a product of higher education, I did what anyone would stereotypically do, more education. And so I did another fellowship, but this time in integrative medicine. And this is a medicine that's oriented to healing, to understand that we're more than our physical ailments. It seeks out all appropriate therapies, including conventional and alternative, and it emphasizes a partnership between the doctor and the patient. It's the bridge that separates that chasm between conventional medicine and other holistic approaches. I also dove deep into fertility awareness-based methods, so like symptothermal or FEM, and I can't tell you what a revelation these were, especially because I, as a purported expert in women's health, had never heard of this before. And so I'm in a unique position to assess the current thinking in women's healthcare. And I can't overemphasize the sympathy and empathy that I feel for all couples and women who are struggling. And I don't blame the people who have made these decisions. I think people's understanding of life is obscured. And of course, children are always a beloved gift. But the truth needs to be proclaimed. We need to proclaim it. Let's start by understanding what exactly we're discussing. And so it might feel like a biology lecture for a minute, but bear with me because I want you to understand so you can explain it to others. First, what is endocrinology, right? It's just a fancy way of saying hormones. What are hormones? They're just messengers. It's the way the brain communicates with different organs and vice versa. And what is a natural cycle? Well, it's the process surrounding ovulation, which isn't just a single event of the egg getting released. It's actually really complex and takes place throughout the course of an entire month if a woman's having regular ovulations. And I think of it as this group of eggs lining up at the start of this imaginary race, okay? And the eggs are the drivers, the follicles that they are in are cars. And they line up, but it's just like any other race. There can only be one that crosses that finish line. And so the fuel comes from the brain, it starts that race, and as they're racing, their exhaust is estrogen. And that goes to the lining of the uterus, and it makes it thicker. And then someone wins the race, that egg gets released, and then the empty car starts pumping out progesterone, which is pro-pregnancy, and that makes the uterine lining really receptive for an embryo implanting. And so now we have the foundation to discern why there's a fundamental issue with contraceptives as an abortifacient. Because that egg and sperm are meeting in the tube. And then that's where it forms the resultant, unique, substantially whole, new life who travels over the next few days from the tube into the uterine cavity, dividing all the while from one cell into hundreds, each cell containing that individual's unique genetic code. And then it enters the uterus. And so you can imagine, for example, using progestin-containing contraceptives, that renders the uterine lining completely hostile to that embryo that's trying to implant. So the potential for destroying life should give us pause. especially when we know that, one, about 65% of US women between 15 and 49 are on contraception right now, which is like 47 million women. Two, out of the 99% of women who have ever used contraception, the majority of them are hormonal. And three, 44% of sexually active teens are on birth control pills. There's about 12 million teen girls in the US, and about half of them are sexually active. Huge numbers. But beyond the moral issue, contraceptives have significant side effects and risks. So we have to remember that hormonal contraception is not our body's own hormones. They're synthetic. They're actually a different chemical structure. And because of that, when they park into the hormone receptor, they signal it longer and stronger. And so that can lead to some of their effects. And because there are receptors in every single part of our body, again, we can get effects from mood, all these other issues. And so this is what brings me to the two reasons why hormonal contraception is an issue. There is an increase in mood disorders like depression and anxiety. This can be debilitating. This can end in tragic suicide. And in fact, there was a 3 times increased risk in suicide in a recent study they did on 1 million women. And then two, contraceptives can increase that risk of blood clots in the blood vessels. And so there's a 3 to 5 times increase in risk of a clot in your leg or clot in your lungs, which can kill a third of people who develop it. So it's a big deal. And then we move on to assisted reproductive technology, which I know has been really at the forefront lately. That's known as ART, and most of it is made up of in vitro fertilization, or IVF. But is IVF the panacea that it's being depicted as? I mean, infertility is unfortunately a very common issue. There was a recent report by the WHO published last year that said that 17.5% of all couples, that's about 1 in 6 couples worldwide, deal with infertility, okay? With this being said, however, there is always hope. 85% of couples will conceive after 12 months of trying. Another 50% are going to conceive after an additional 3 years. And so at 4 years trying, 93 to 95% of couples will. Listen, I can understand the common thread amongst infertility patients of a sense of powerlessness, of anxiety, of fear, because it's a unique and it's a profound suffering. And what is desired is a good thing, the child. But I believe this may also result in a quest to exert control over the process of fertility and its treatments. And this can sometimes be empowering if we can understand our options and choose one that we're going to feel at peace with, but it can also become pathologic in that people will begin making decisions that can haunt them, like wanting twins or choosing that boy or that girl, especially when outcomes aren't as hoped for. So in IVF, again, you get injections every single day for a period of a couple weeks with fertility medications to cause lots of eggs to mature in the follicles. If we liken it to that race analogy, it's kind of like making everyone a winner. But before they can cross that finish line of ovulation, they get plucked out and they get handed over to an embryologist. This person either puts the egg into a dish with multiple sperm, or they inject each egg with a sperm that they choose. And the next day the dishes are checked, and about 80% of them are now going to contain an embryo. Let's take a moment to reflect on the unique, new, substantially whole human being who is now formed. They're kept in dishes over the next few days, and at this point they have one of 3 fates. They may be biopsied to have their chromosomes screened. They may be transferred back fresh, is what it's called, at 3 to 5 days of their life, or they may be frozen indefinitely in liquid nitrogen-containing canisters. So I just want to mention the magnitude of ART right now. And so this is from 2021 National Summary, US Clinics. And what it tells us is that 240,000 patients in that year underwent over 400,000 cycles. But out of those, there were 97,000 live-born infants. And so what that means is the number of infants from those ART cycles comes out to about 37%. So not 100 as a lot of people think, right? I want to also explain to you that the myriad of issues that IVF engenders. So, I mean, the fundamental one is the creation of a human life. How? Because a new, unique, substantially whole human being was created with that union of egg and sperm. That embryo has a whole, full human genome that will then be the code to grow and differentiate. It's the juncture where life begins. And so it paints a different story when I think back on the 15 mature eggs that I used to get. At most, one time, I had a lady, we retrieved 60 eggs from her, believe it or not. And if we think of 15 mature eggs, we would get about 12 embryos. But at most, we'd only select a few to transfer. So what to do with the rest? You have to either discard them or you freeze them, which corresponds to an indeterminate existence and the likelihood of never being utilized. One report from the UK actually says that an average of 15 embryos is created and that only 7% of them are ever used. And so what that means is 93% of them are either destroyed or frozen with very low odds of ever being implanted. The other ways that embryos can undergo destruction are as follows. 1, human error. There could be accidental destruction or damage. I mean, this is what that whole case is talking about in some ways. 2, suboptimal conditions, and that can mean contamination of their dishes or of the nutrient media that helps them be nurtured. It could mean a change in the incubator temperature. They're kept in little incubators. It could be, a lack of sterile procedures in the lab. 3, manipulation. These embryos have to endure biopsies, freezing, thawing, touching all the time as they're looking at the cells and how they're growing. 4, the storage, again, perpetually in perpetuity. And then 5, rapid adoption of new technologies with the potential for imperfect tests. So this can include what I was mentioning before, which is chromosome screening. So the original iteration of this chromosome screening was enthusiastically adopted by so many different centers in the US for a while until they finally did a multi-center randomized controlled trial. That's the gold standard. And what they found was that there were significantly lower chances of pregnancy and live birth in the embryos who underwent that screening, even though it was supposed to make the birth rate higher. Oops. Technological advances in and of itself are not necessarily bad, right? But we need to objectively determine the full consequences of these permanent actions. And so it kind of philosophically is this shift from man as thinker and creature to man as a worker, as composed of parts that can be assembled and disassembled in this vacuum of morality. And so there is active research as we're talking about editing people's genes, cloning, artificial wombs, 3-parent babies. I mean, that's been done already. And I share all of this, not to reprimand, but I share it with love, right? These issues have to be honestly discussed. And I think that we need to change, but we have to use this truth not as a bludgeon, but with charity. I just want to leave you with a few of the risks to moms and children, because I think, again, it helps as you're talking to others about this and spreading the word. And so take note of what moms who have conceived by IVF have experienced as an increased risk. There's a 26% increased chance of preterm birth, and that is the #1 cause for babies being born with damage to their organs, with cerebral palsy, or with death. There's an over 5 times increase in risk of a problem with their placenta. The placenta is supposed to be attached very slightly to the uterine wall, but sometimes it can invade in, and that can lead to life-threatening bleeding at delivery, and so that increases 5 times. But there are also risks for the children, right? There's a significant increase in risk of birth defects in babies born to IVF and ICSI. There's an increased risk of stillbirth that's 4 times higher than if they're naturally conceived. And there might be slight increases in the risk of cancer, like leukemias or liver tumors. So what is the alternative, right? I mean, there are good options for women and men who are struggling with infertility. And this involves integrative fertility and restorative reproductive medicine. It's a whole person approach. It looks at understanding the why behind these hormone issues and doing a deep dive into the hormones, into toxins, decreasing inflammation, and restoring the reproductive system using a variety of different supplements, nutrition, and even surgeries to restore the structure and anatomy of the reproductive tract. And it's fertility awareness charting. It can help women and men understand women's bodies better. And so I would path forward for us is to be a proactive participant in your own health. If you haven't yet, try charting if you're a woman. Try to figure out what that means if you are a man. There are lots of classes. Number 2, optimize what's in your control. And that could be as simple as deciding to eat less processed foods or decrease plastics, irony, but or even to just sleep more properly. And then 3, make sure you're fully informed regarding consenting to something, right? You need to understand all the options, the pros and cons, and the full secondary consequences of each choice. So the end doesn't necessarily justify the means. We have to be grounded in objective truth. How do you know if you have a doctor who is open to restorative reproductive medicine? Well, you can look on websites like Facts About Fertility or the IRMA website. How do you figure out charting? You can go to reputable websites like Fertility Science Institute or Natural Womanhood is wonderful. And trust your gut. If it doesn't feel like your values align with your doctors, there's a million of us. Just find someone who's going to respect you. That is absolutely what you deserve. And so infertility is a symptom of an underlying disease. And women deserve a diagnosis of what's causing their infertility, because that is not only causing infertility, but probably have a ripple effect on their overall health. And this may be more challenging then to carry a baby to term. And so through IVF, you make the baby. So again, why is the pregnancy rate not 100% with IVF? If the issue is making the baby, that's been done, right? What that means is the issue might be in the embryo, or in the transfer, or the implantation, or in the pregnancy itself. So we're not necessarily treating the underlying causes. And many times couples don't realize the full consequences. They're told that IVF can work, but internalize it that it will work. And they're focused on that path to get a baby, but don't realize that when their family is complete, that they're gonna have potentially many more embryos. And they'll be suffering in deciding what to do with them. They find themselves paying, on average, about $70,000 for a treatment to have a live birth. And so uninformed choice is not a free choice, it's a manipulated choice, actually. What does informed mean? If we were truly informed that an embryo is a new, unique, substantially whole human being, and you said, I am choosing this way to create a child, I'm choosing life, I'm choosing this even though I have to take 10 of these embryos and select the best one to transfer, objectively, you're choosing potential death for those other 9 embryos. And so again, objectively, that is not a choice for life. So even with the purest of intentions, which the vast majority of doctors and patients have, you're also choosing all the consequences that follow. And so our subjective intentions do not rule out the objective truth of the death of these embryos. And so we're faced with a significant ethical distress and its fallout and a knowledge of the potential risk, which is not insignificant. Whereas if we treated women and their underlying causes like PCOS or endometriosis, for example, with a restorative reproductive medical approach that has a cumulative pregnancy rate of like 30 to 40%, we can really approach that of IVF. So imagine if we were to start with restorative reproductive medicine and we used treatments that allowed us to heal these women, and instead of freezing eggs, we just taught women how to understand their bodies and chart properly, and treating them as the 5th vital sign that we know ovulation is. And so when we identify these diseases and issues from an early age, and so then if they deal with it, if they're dealing with infertility, they can address it in a way that will help them achieve their ultimate goal of being a healthy mother, giving birth to a healthy baby. So do we want to be well? Let's rise, let's take up our mats, and let's walk. Let's support, let's love our brothers and sisters who are dealing with this, but let's be courageous and for truth. Thank you.